I'm Dr. Sandeep Jha. I'm a liver disease specialist and liver transplant surgeon, and I work as a consultant at Manipal Hospital, which is in Dwarka, Delhi, India. Today we are going to talk about acute kidney injury or hepatorenal syndrome or kidney damage in patients with cirrhosis or chronic liver disease. So patients of cirrhosis are at increased risk of acute kidney injury or hepatorenal syndrome, and this happens because of altered blood circulation inside the body of any patient who has cirrhosis or chronic liver disease, and this leads to less blood flow to the kidneys and subsequent damage. This can also be due to the primary underlying cause of cirrhosis, which could be also damaging the kidney, like diabetes or hypertension. And development of acute kidney injury or hepatorenal syndrome is one of the most feared complications of cirrhosis. And up to 25 to 40% of patients of cirrhosis might develop acute kidney injury or hepatorenal syndrome. And out of every 100 patients, up to 30 to 40% of the patients will die within 1 month of developing this complication. And it is said that up to 65% of such patients who have cirrhosis and then develop AKI or HRS will not survive beyond 1 year. So how do you keep track of acute kidney injury or hepatorenal syndrome? So ideally, it is said that serum creatinine is a marker of kidney injury, and in any patient the creatinine levels are less than 1 milligram per deciliter in a normal patient. However, if your serum creatinine is above this level or it has jumped to more than 50% of your previous known level, then it can be an indicator of AKI or hepatorenal syndrome. If you are producing very less urine, then it can be a marker that you are developing acute kidney injury or hepatorenal syndrome. And any complications developing in patients of cirrhosis can lead to development of AKI or HRS, like dehydration, loose motions, infection, or bleeding. All these are very common risk factors or common complications that lead to development of acute kidney injury or HRS. So the best way to keep track of this is that you should get your investigations done every 3 months, and that is why all patients of cirrhosis are told to follow up with a doctor every 3 to 6 months so that investigations can be done and we can catch this complication early. If you develop any of these complications like diarrhea, dehydration, bleeding or infection, fever, then you should immediately visit your doctor and get the test done. Also, if your urine output is decreasing, then it is another reason to go and visit your doctor. Every 3 to 6 months you should get your checkup done. That includes basic blood tests and ultrasound, maybe a few other tests that will help track how your cirrhosis is progressing or you are at risk of developing complications. Sometimes there may be no symptoms at all and you could be developing AKI HRS, and it may be simply increased lethargy or increased malaise or weakness that you're feeling over the last few days, and that should also alarm you that something wrong might be happening and you should get checked up. Many of these patients with cirrhosis are on diuretic pills or water pills, which help to reduce the amount of water in the tummy. But the side effect is that this same water pill or diuretic can damage your kidney. And if you are on those diuretics, then you should be aware that these diuretics can damage your kidney. So very frequently, the first thing that a doctor does or physician does is to ask you to stop taking these water pills or diuretics. And if any damage is there, then it can be reversed. Secondly, if you are developing symptoms like diarrhea, dehydration, fever, bleeding, black colored stools, all these can be indication that you are developing other complications of cirrhosis, and that can lead to AKI or HRS or kidney damage. Sometimes your underlying cause or primary disease can be the reason for you developing acute kidney injury. Both diabetes and hypertension are related to development of acute kidney injury. They can directly damage the kidney independent of your liver condition. Also, the most frequently diagnosed condition these days is NASH or NAFLD, non-alcoholic steatohepatitis, and or non-alcoholic fatty liver disease. So any patient with NASH-related cirrhosis is at a very high risk developing acute kidney injury or hepatorenal syndrome. Also, patients who have underlying hepatitis B or hepatitis C, or their liver is damaged due to alcohol, you should be aware that these conditions, hepatitis B, hepatitis C and alcohol, can also independently damage the kidney irrespective of your liver condition. So that can also be the cause that is damaging your kidney further. So you should visit your doctor and get checked out for these conditions if they are causing problems with your kidney. So acute kidney injury and hepatorenal syndrome can be diagnosed early, and that is our best bet of treating these conditions. If you are in regular follow-up and these conditions show up on your tests, then they can be handled very effectively. However, if these conditions develop, then like I said, the risk of mortality and risk of deterioration of disease rises significantly. So when you visit your doctor and he's suspecting AKI or HRS, he might like to admit you in the hospital, rehydrate you by giving albumin and IV fluids. He might like to start you on antibiotics. He might stop your diuretic pill and water pill like I mentioned previously. If he's suspecting that there's infection, then he might treat you with appropriate antibiotics, or he might want to take out the water from your tummy because the ascites in your tummy or the water in your tummy can get infected, and that can lead to AKI or HRS. Also, there are some drugs that help, like terlipressin, that can help in relieving this condition or improving acute kidney injury or HRS in patients who have cirrhosis. And also, if complications are expected like bleeding, then it can be upper GI bleeding or bloody vomiting or MELD-Na. Then this can be adequately addressed by medications or by doing an upper GI endoscopy. And lastly, if you are developing AKI and HRS, it is very important that you get a liver transplant as soon as possible. And if you have documented AKI HRS, then you can be pushed up the list on a waiting list for liver transplant, or your doctor might advise you to go in for a living donor liver transplant as soon as possible. Because if you're developing AKI or HRS and you have cirrhosis, then in few patients the transplant can become contraindicated. That means you might no longer be eligible for a liver transplant because it becomes a very high risk case. So in that situation, it is always better that if you are treated early and if it is diagnosed early, then you can go in for a liver transplant as early as possible. Also, in a few patients who land up in a liver failure as well as kidney failure, a few patients might be recommended to go in for a simultaneous liver kidney transplant, and that becomes a significantly more advanced surgery and there's high risk of complications. So you should be aware that AKI or HRS developing in a cirrhotic patient is a very severe complication, and your best bet is to monitor against this condition by getting your regular checkups done. So if you feel you have benefited from this video and there was relevant information, then like this video and share and subscribe this channel so that more and more people can benefit from it. Thank you.